I think that the issue of diabetes almost needs to be put into context, and the context is that that anything that makes you different as a child certainly creates some stresses and strains, whether it's that you have a chronic medical condition like diabetes, whether you have a large birth defect or a large, some kind of birthmark that's unusual or discolored that people can see, or maybe you have a lisp, or maybe you have to wear glasses in first grade, sort of anything that makes you a little bit different. Certainly tends to sensitize you. So one of the things that we often do and that you can help your child do is to think a little bit about what kind of questions people at your child's age might ask. So a 5-year-old who sees somebody getting a shot, they're going to think that your child is sick. And so a question might come to your 5-year-old from one of her friends that will say, well, are you sick? And you need to tell your child, no, they're not sick. They just have a medical problem called diabetes and they have to take shots. But they're very healthy and they can do anything that anybody else wants to do. If you talk about let's say a junior high school age child that has diabetes, again, we often will spend a lot of time in the office talking about social situations and how they might be handled. So a good example would be a birthday party at school. Well, can we eat carbohydrates? Can we eat birthday cake? The answer is yes, but there's always the but, and the but is we need to kind of know about it in advance so that we can make a plan to check a sugar before the birthday cake is served and figure out about what size the pieces are going to be so that we can give an appropriate amount of insulin to cover the carbohydrates that are contained in the birthday cake. For the high school kid who, let's say it's a 16-year-old guy who's just starting to date, and maybe the young lady that he's going out with doesn't know he has diabetes, but they're going out to dinner, well, he's going to have to give a shot. And so a lot of times we talk in the office, but also it's something a parent can do. How are you going to handle this to provide what I guess we call in medicine anticipatory guidance? So if this happens, what are you going to do? What are you going to say? How are you going to talk to your girlfriend about the fact that you have diabetes? The other thing is that as your child grows older and develops relationships, I often say, it's perfectly fine if your child wants to bring his or her girlfriend or boyfriend in the office and we can have a little chat about diabetes.